talk to you about something that is close and personal to my heart, Alzheimer's disease. I've had two family members diagnosed with Alzheimer's disease, my uncle and my grandma. Ever since we found out about my grandma being diagnosed with Alzheimer's disease, it hasn't been an easy ride for neither myself nor my family. Watching my grandma go through the different stages has not been easy, but I found comfort in doing my own research and gaining knowledge about the disease and what happens. Do any of y'all know someone with Alzheimer's disease or have a friend that may have someone with Alzheimer's disease? You? Yes. Anyone else?
No, not me. Doctor.
You're a doctor? Okay, so these are some of the statistics about Alzheimer's disease. It's the sixth leading cause of death. Over 5 million Americans live with Alzheimer's disease, and it's the only disease that cannot be stopped, prevented, or treated. 1 in 3 seniors die with Alzheimer's disease or another type of dementia cause. If you look at the right-hand corner, there's 15.4 million caregivers that donate 17.5 billion hours of care, basically for free. They take care of the patients with Alzheimer's for free, mainly because it could be a family member, a mother, father, sister, and they really can't afford to put them in a home. On this side, you'll see that Alzheimer's disease has a 17.2% death rate over breast cancer and prostate cancer. Any other questions on any of the statistics? No. Yeah. The agenda for today is what we're going to talk about is what is Alzheimer's. I'm also going to show you the different signs that Alzheimer's has, the different stages every Alzheimer's patient goes through, the Alzheimer's risk, its diagnosis and treatment, and life with Alzheimer's. First up is what is Alzheimer's? Alzheimer's is a form of dementia, which is a mental ability that you end up losing your memory slowly but surely. First, you'll start with just forgetting your phone number, and then you'll eventually forget how to eat and how to do simple things like going to the restroom, brushing your teeth, things like that. It's a progressive disease that worsens throughout the years, and it averages between the ages of 65 and up. Even though it does start when you get older, it can start between the ages of 40 and 50, but it won't be as noticeable as it is as you get older. Alzheimer's is actually the 60 to 80% of all dementia cases for all patients. This is actually a picture of the brain. So you'll see on this side is a normal person's brain and a person with Alzheimer's. You'll see the different gaps between where the memory and languages lack. And Alzheimer's, what it does is basically prevents it from functioning well and makes us lose our memory on day-to-day things that we do every day. Any questions so far?
No.
Know the signs. There are 10 different signs that they show here that you should be familiar with to know if someone that you may know has Alzheimer's disease. The first one is the memory loss that disrupts daily life, and that is basically starting to forget recently learned information. If you read a book yesterday, you might not remember it today. And forgetting important dates like someone's birthday, or if you have an event to go to, you might forget it. You might also need help remembering that you have a doctor's appointment. You might start needing help from family members to remember certain events and have learning aids. The second one is challenges in planning or solving problems. This is when you'll start having problems doing simple stuff like math problems, paying your bills, stuff like that you do on a monthly basis. The third one is difficulty completing familiar tasks at home or at work. This one is daily recipes that you do on a daily basis, or like cooking recipes. You'll forget about it when you used to know it by memory without needing instructions on it. Fourth is confusion with time or place you're in. This is when you start losing track of time. You can't tell if it's day or night. You don't know what day of the week it may be. You might not even know where you're at. You might be in your bedroom and you think you're somewhere else completely. Number 5 is trouble understanding visual images. This one is you have trouble differentiating colors. You might see yourself in the mirror and see someone else instead of yourself. So you might end up being confused and think there's someone else in the house with you and there's actually no one there. 6 is problems with words, speaking, or writing. You'll have trouble speaking daily words that you use every day. You'll have trouble writing. You'll confuse words when you're reading. And mainly you'll start forgetting everything you might have had said before. You'll also start realizing that you repeat a lot of words. You might ask the same questions more than once to your family members or your friends. 7, you start misplacing things and losing the ability to retrace your steps. You'll lose the simplest things, from your phone to your remote. As you get older, if you have a walker or a wheelchair, you might just misplace that or your keys, and you won't even remember or be able to retrace your steps. 8 is poor judgment. You'll start judging people wrongly. You'll see that things are missing and you'll start judging them as stealing or taking stuff away from you, and you might not even know you're doing it. 9, withdrawal from work or social activities. This is when you see your family members start withdrawing themselves from wanting to attend like family barbecues, family dinners, parties, or even work-related stuff. They'll be drowsy and wanting not to go to work the next day. 10 is change in mood and personality. This one is a tricky one because it's kind of like bipolar, so you'll think they're going bipolar, but you'll see that they'll be happy one day and then like really depressed the next day, not want to get out of their bed. And it's very depressing to see personally because I've seen it. Any questions?
I have a question.
Yes.
Do you have to have all of these signs in order to have this disease, or is it a progression?
No. These are just the signs. If you see any of these happening, it might be a case of Alzheimer's disease. So you don't have to have all 10, but you'll eventually end up having all 10 steps. This is just a diagram of what all the signs are. You'll see how puzzles sometimes might help, physical therapy might help, math problems, telling your family members to start counting backwards, saying their alphabet backwards to try to test their ability to remember stuff and learn things. Another thing is pictures, trying to make sure they're still familiar with faces of family members, stuff like that. Stages, there are 7 stages in Alzheimer's disease, and they do progress over time. The first stage is a normal function. Any of us can pretty much be living with Alzheimer's disease and not even know it because you're living perfectly fine with very few memory loss, but that happens to a lot of people nowadays. The second step is very mild cognitive decline, which is age-related change. This is the first 2 stages. If you go to the doctor and try to get a test done, they won't diagnose you with Alzheimer's right away. The first one might just be because you're too tired, you're overworked, overstressed. The second stage might be because you're getting older and they just believe you're getting older, so your memory's changing and you're not remembering things. The third stage is when you start noticing some difficulties, which is the earliest stage for diagnosing Alzheimer's disease. By this stage, you'll start having trouble remembering names, you'll start having trouble remembering dates, putting faces to names, pictures together, stuff like that. You'll start misplacing objects and you'll start having trouble organizing and planning daily events, work. The fourth step is a moderate cognitive decline, and an examination should detect those Alzheimer's symptoms, and that's pretty much when you'll be diagnosed with Alzheimer's disease. And you'll start becoming a little bit more moody by the 4th stage. By the 5th stage, when you hit moderate, severe cognitive decline, is when you'll start losing memory and it'll be noticeable to your surroundings. You'll start needing help with day-to-day activities like grooming. You'll start forgetting to take a shower, brush your teeth, so you'll start needing help with that. You'll get confused with where you are. You also start confusing years, so you might start living in the past on this stage, which is very hard to watch when the family member might be remembering an old relative and they might have had passed. So it's hard to kind of live with them and tell them they'll be right back and they're really never coming back. Stage 6 is severe cognitive decline. This is when memory loss worsens, the personality changes, and extensive help was needed with daily activities. By this time, Alzheimer patients will usually forget to eat. They won't know how to eat anymore. They'll slowly start forgetting how to use the restroom. Their memory is just worse and worse. They won't recognize seasons. They can't dress themselves anymore at this point. Stage 7 is very severe cognitive decline. This is the last stage of Alzheimer's disease, and by this time, the memory is completely gone. They will not know how to eat, how to use the restroom. Their sleeping patterns are horrible. Their depression level is pretty low, and they can go hours with just sleeping or hours with just waking up or just staying up. Any questions on stages?
I mean, not necessarily stages, but as far as the doctor, you said, is there some specialist?
There's not really a specialist for Alzheimer's. You can get a test by a physician, and they'll just do random tests like blood work and brain tests and stuff like that. But there's not necessarily a specific doctor for Alzheimer's disease. Any other questions? Different symptoms or memory loss is in the mild, which is very common as you get older. But once you reach the moderate, you'll see personality change. You'll stop recalling stuff, and long-term memory is affected and stuff like that. And you'll see in the severe is probably the worst part, and that's when care is really needed by family members, and that's usually when patients are sent to an Alzheimer's retirement home, so they get all the care they need 24/7. The risk, I divided it between age, family history, and the chromosomes. So the age is between 65 and older. Once you reach 65, every 5 years, your chances of having Alzheimer's disease increases. And after the age of 85, the risk reaches nearly 50% of being diagnosed with Alzheimer's disease. Family history, if you have any family member with Alzheimer's disease, you are most likely capable of having Alzheimer's disease. If you have more than one family member with Alzheimer's disease, your chances pretty much double. The chromosomes, these are the 4 chromosomes that they have done research on and have seen that might have an effect on where Alzheimer's disease comes from. You'll see on the next slide the 4 chromosomes. You'll see on the chart, this is from 2010, where it has increased between the ages, and between 2000 and 2010. You'll also see that females have a higher percentage of having Alzheimer's disease than males, and these are actually the chromosomes. The chromosomes that might be able to cause Alzheimer's disease are chromosomes 21, 19, chromosome 1, and chromosome 14. Questions? The diagnosis and treatment. The diagnosis includes thorough medical history, so they'll go through all your family history and see if you've had anyone with Alzheimer's disease before. They'll go through a mental status testing, which is checking basically if you can count from 1 through 10 and backwards, know your alphabet, your colors, recognize familiar faces, and stuff like that. There's also a physical and neurological exam, and there's a test for blood and brain test, so they'll check your blood levels, they'll check your brain, make sure everything looks okay and they don't see any gaps that might be causing Alzheimer's. The treatments, unfortunately there is no cure for Alzheimer's disease at this time. There are drugs and non-drug treatments to help with behavioral systems. Basically the only treatments there is medication to help with memory loss and to help keep the Alzheimer's patient's behavioral level well. The thing with Alzheimer's patients is that they do tend to act up sometimes, and they'll start getting very aggressive and they might want to punch people. So these medications help just maintain that, but it doesn't really help the disease. Any questions? Okay. Life with Alzheimer's. It affects lives of millions. It doesn't just affect the life of the Alzheimer patient, it affects everyone around them. As a family member, really the only thing you can do is just enjoy your time with the loved ones and accept that there is going to be changes and they aren't going to be easy. And learn to not take things personally. It's very hard to watch, you know, in my case, my grandma, I see her every day. I go to school, I go visit her, and then I go home. And as the Alzheimer's progression started, even though I'd see her every day, there'd be days she couldn't remember my name, she didn't know who I was at all. And it was very hard to see and to accept. And it was always very sentimental because yesterday she remembered me, today she didn't, and I don't know if she'll remember me tomorrow. As for the Alzheimer's patients, it's really just being open about your feelings and asking for your help. As they get older, it's harder for them to ask for help from their family members. And as a family member, you have to just accept what's going on and ask for help, whether it's from your doctors, from your siblings, or from your friends, and just enjoy every minute you might have with that family member. And living a healthy life for you personally before you get into that risk, get yearly checkups. As well as for the Alzheimer's patients, they still need to get their checkups and make sure everything else is fine with heart, diabetic, and not just let Alzheimer's be the end of it. The normal life from Alzheimer's patients from the day they're diagnosed is between 8 to 20 years. So it can be a very long process or it can be a very short process, depending on how far along you've caught it. And these are my sources. Any questions on anything on my presentation?
Yes.
Yes.
So you mentioned that you have 2 family members that suffer from Alzheimer's or currently suffer from Alzheimer's. So that increases your risk. Is there anything that you can do to not have that happen to you or make it to where it's later in age, kind of preventative method?
Really, the only thing I can do for myself is try to live a stressful-free life, which is hard. But it's mainly just, checking up on myself every year because I am higher risk, trying to live stress-free, making sure I'm up to date with all the symptoms, making sure, testing myself daily or weekly or monthly on trying to count 1 through 10 and backwards and making sure I know my alphabet and stuff like that. Any other questions?
I think it was a lot of good information, so, yeah, really good.